Hello, welcome to Blue Cross Blue Shield of Arizona, AZ Blue. Here's the game plan. We'll quickly review some Medicare basics, get into highlights of our 2026 Medicare Advantage benefits, and wrap up with a recap. Let's dive into Medicare basics. To begin, it's important to understand that Medicare is broken into 4 parts. Part A is hospital insurance. This includes hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Part B is medical insurance. It helps pay for doctor's services, outpatient hospital care, durable medical equipment, and some medical services that aren't covered by Part A. Parts A and B are provided by the federal government. Part D is prescription drug coverage. Part C, also known as Medicare Advantage, is an all-in-one alternative to original Medicare. These plans include Part A, Part B, and usually Part D. This is what AZ Blue offers. Next, you need to know about enrollment periods, which are the times when you can enroll, disenroll, or change your plan. During the annual election period, or AEP, you can make changes to your health or drug plans or switch to original Medicare. Medicare Advantage members also have an open enrollment period where they can make a one-time change to a different Medicare Advantage plan or switch back to original Medicare and join a standalone Medicare prescription drug plan. You may qualify for a special election period under certain conditions, such as aging into Medicare eligibility, moving out of your service area, a change of income, losing Medicaid, being impacted by a natural disaster or emergency, or a condition that qualifies you for a special needs plan. Now let's review some terms you should know. A copayment is the fixed dollar amount you pay at the time you receive medical services or fill a prescription. Coinsurance is usually a percentage of the amount you pay for your share of the cost for certain medical services, prescription drugs, or durable medical equipment. A deductible is the amount you pay out of pocket before AZ Blue pays for your covered medical services. Now, let's get the scoop on MOOP. MOOP is the maximum out of pocket. This is the most you'll have to pay for medical services in a calendar year. MOOP protects you from catastrophic costs. Out-of-pocket expenses for out-of-network doctors and facilities. Non-covered services and monthly premiums do not apply to MOOP. Also, for Part D, copays and coinsurance do not apply to MOOP. You may have heard about Medicare supplement plans. Here's a comparison of these plans versus Medicare Advantage plans. As you can see, Medicare Advantage covers a lot more and offers more predictability with costs. Keep in mind, you're not allowed to have both Medicare Advantage and Medicare Supplement at the same time. Now let's look at highlights of AZ Blue's 2026 Medicare Advantage plans. AZ Blue Medicare Advantage plans are health maintenance organizations, or HMOs. They allow you to get care within a network of counties. With an HMO, you have a primary care provider who oversees your care and guides you to get services within the network. Our plans include rich medically necessary benefits and extras like dental, vision, hearing, fitness, over-the-counter or OTC, and more. Star ratings are based on member surveys, member claims experiences with AZ Blue and their providers, as well as customer service inquiries. Our Blue Best Life HMO plans earned a 4.5-star rating in 2025. Star ratings mean you can have confidence in knowing AZ Blue is here to help you manage your health. It's time to look at the key benefits for AZ Blue's Medicare Advantage plans. First, we'll look at the Blue Best Life Classic HMO plan. The plan gets you low-cost medical coverage that's easy to use. It has a $0 monthly premium, has $8 specialist copays with no specialist referral needed, and its network includes Maricopa, Pinal, and Pima counties. It's also loaded with great additional benefits like dental, hearing, vision, and OTC benefits. Remember we talked about MOOP? Well, this plan has a maximum out-of-pocket cost of just $2,800. With the Blue Best Life Classic plan, you'll get access to over 3,000 primary care providers, or PCPs, more than 15,000 specialists, and over 50 hospitals within our service area. For 2026, ER visit copays are $135. Hospital stays of 1 to 5 days are $150 per day. The other AZ Blue Medicare Advantage plan is Blue Best Life Plus. This plan has really strong benefits. It has a $44 monthly premium, $20 specialist copays with no specialist referral needed, and its network covers Maricopa, Pima, and Pinal counties. The Plus plan has our lowest max out-of-pocket at $2,500. If you need to find a provider or specialist, chances are they're part of our network of more than 18,000 caring providers. There's no cost for primary care provider visits or routine lab work. And more good news, the Plus plan will have an enhanced hearing benefit in 2026. You don't need a referral to see a specialist in either the Classic or Plus plan. Please note, there are some specialists who make it their policy for you to have a referral from your PCP. And some services and prescriptions are covered only if your doctor or other network provider gets prior authorization from us. Now let's look at the prescription drug coverage for Classic and Plus plans. Whichever Medicare Advantage plan you select, it will have 3 stages of prescription drug coverage. Once Stage 3 has been reached, you will not pay coinsurance or copayments for the remainder of the year for your covered Part D drugs. Our plans feature formularies, which are the list of medicines the plan covers. You'll need to use the pharmacies in the plan's network to fill your prescriptions. Some covered drugs may have added requirements or limits on coverage. These may include prior authorization. Your doctor must get approval from your Part D plan before certain drugs can be prescribed. Step therapy. You must try certain drugs to treat a health condition before the plan covers another drug. Quantity limits. Specific amounts of a drug the plan will cover. Okay, let's talk preventive and comprehensive dental coverage. Members can receive dental services for a $10 office visit copay. Classic members have a $2,000 annual maximum. Plus plan members have a $3,000 annual maximum, which includes implants. Before we end, we've got to tell you about some of the great extras you get with AZ Blue Medicare Advantage plans. You get Silver Sneakers memberships at no cost, with access to thousands of fitness locations nationwide, plus fitness activities designed for people of all fitness levels. You'll also get access to Blue 365, our members-only health and wellness discount program, as well as hearing and 24/7 nurse on call, so you can talk with a registered nurse anytime you need. Both plans also have routine vision services, including a $0 copay for a non-medical examination to check vision, screen for eye disease, and/or update eyeglass or contact lens prescriptions. There's also a $200 annual allowance for frames or contact lenses. Here's a recap of our 2026 Blue Best Life Medicare Advantage plans. Here are the top 5 reasons to choose a 2026 Blue Best Life plan. Number 5, Arizona-based member support. Number 4, you'll get extras like dental, vision, hearing, fitness, over-the-counter, and more. Number 3, see any in-network provider without a referral. Number 2, affordable specialist copays ranging from $8 for the Classic HMO plan to $20 for the Plus HMO plan. And the number 1 reason to choose Blue Best Life: enjoy access to over 3,000 PCPs, more than 15,000 specialists, and more than 50 hospitals. AZ Blue is proud to be Arizona's hometown plan. We look forward to serving you in the year ahead. Thank you for joining us today.